Today I will be giving Brittany the Eating Disorders Quality of Life Instrument, or the Edqol. This has 4 subskills: psychological, physiological, cognitive, financial, and work and school. The scale scores are calculated by averaging the items of each scale, and the total score is also calculated by averaging the scores of the items of the test. A lower score indicates a better quality of life. Convergent validity correlations for all 4 subskills are higher than the discriminant validity. And the overall psychometrics of the test are very good. The test has internal consistent subskills that demonstrate good retest or test-retest reliability. It appears to be a valid measure of health-related quality of life for disordered eating patients, and the Eating Disorder Quality of Life scale is sensitive to group differences between disordered eating and non-disordered eating groups. So test-retest was good, except for the work-school subscale, which was 0.14, and then the overall total score was 0.93, so that's pretty good. So now we'll get on to the test. It's a self-report test, so I'll have Brittany start the test. Okay, so before we get started, I just want to take this time and tell you that if you have any questions along the way, you can ask me and I will do my best to help clarify something, okay?
Okay.
So Brittany, please answer the following statements according to how well they describe you in the last 30 days. Please be as open as possible. There are no right or wrong answers. Place an X under the appropriate column. For those items that do not apply to you, please leave them blank.
Okay, I think I'm finished.
So now I'm going to score the test for her and then we will discuss the results. So, just to recap, this test is applicable to those with eating disorders, specifically bulimia, because the score shows whether a person struggles in different areas of their life, like I mentioned. On a scale of 0 to 4 or never to always, they can open up about different aspects of their eating disorders and how it affects their everyday life. And those areas are like, for example, such as how they view their body image or weight, and then also if it leads to social isolation. As I mentioned, the scores gathered from the Edqol instrument can show whether one has bulimia or any other eating disorder. And I believe that someone who has an eating disorder has distorted belief of their body image, and therefore it may distort all of their other cognitive beliefs, which would interfere with their occupational performance. And then also, as I mentioned earlier, it is a self-report, so it would be easy to use in any setting to see if someone is struggling with an eating disorder. because it was designed to apply to people who have symptoms commonly seen in patients with an eating disorder. So now, Brittany, we will discuss your results. For each subscale, it correlates with the actual mean of those with an eating disorder, okay? And so I just kind of want to ask you a couple questions. And so, have you been having like a struggle with this? Like, have you been having signs or symptoms of like an eating disorder?
Yeah, I notice myself always having low self-esteem and just being embarrassed on how I look and eating around others, and I feel like that's when I first started noticing it. That's when I was not wanting to eat around other people.
Okay. Do other people know? Like, do your friends know?
No, I usually try to keep to myself just because I'm so embarrassed about it.
So it's led to some social isolation?
Mm-hmm.
Yeah. Do you talk to your family or anybody, or do you just stay at home a lot?
I just stay at home. I mean, I try to hide it from like my parents and my friends because I'm embarrassed that I'm feeling that way, but I'm also embarrassed with the way I look, so.
Okay. And then also I see that it hasn't led to like any work absences. So do you just like go to work and go home?
Mm-hmm.
But has it led to any like, I don't know how to put it, but like, does it affect your like role at work? Like, do you see yourself like going to the bathroom a lot,
Mm-hmm.
or
going to the bathroom, trying to just, stay quiet, stay low, I don't want anybody seeing me, and I get the job done and I go home.
Okay. Well, thank you for answering some of those questions for me. I know it's a hard thing to talk about. We will set up another time to talk, and I look forward to seeing you again.
Thank you.